I am Dr. T. Varun Raju, Head of the Department, General and Laparoscopic Surgery, St.Theresa Hospital, Sanath Nagar Hyderabad. So today's health topic is the treatment of gall stones. So these stones forms at gallbladder, which is just like a balloon shape with greenish or yellowish fluid inside, which is just lying below the liver. So this gallbladder contains a stagnated bile or a concentrated bile, and this bile directly comes from liver to the intestine through a small pipe, which is called as common bile duct. So this gallbladder is having no function in our body except for concentration of the bile. So whenever we take the food, it is going to contract, squeeze itself so that the concentrated bile will come and meet with the small intestine for the digestion of the food. So actually there is no role, but if the gallbladder don't work as the age goes on, or as in pregnancy condition, or certain unknown reasons where the gallbladder don't contract and it will stagnate the bile, that bile leads to formation of the stones. So usually there are cholesterol stones by cholesterol, which is nothing but a fat kind of thing which is present in the bile and that may precipitate in formation of the stones. Or it may be black stones because of the rupture of the red blood cells. Or it may be mixed. In India, mixed stones are common. And it happens because the gallbladder is not working properly, or the foods were junk foods, not taking water properly, not doing exercise, or not taking fiber diet. So these are the major causes of formation of stones in the younger age. So gallstones may form in the young people, middle people, or the elderly people. If the stones are there, usually they are asymptomatic, they don't lead to any symptoms except dyspepsia. The patient will have bloating of the gas after taking the food. They don't have the digestion signals to their mind. So some of the people, they also contain pain at right side of the abdomen, which goes to the shoulder. And these conditions are very important because the stones are got stuck in the gallbladder. Sometimes if the stones passes down, they leads to jaundice. That is called as obstructive jaundice. Some of the stones may obstruct and the gallbladder will enlarge with big sized balloon that leads to rupture, and or it may contain the pus. So these are the complications they may happen. And in especially North Indian patients, when the stones are there is a chance of cancer of the gallbladder. So the treatment is nothing but we need to remove the gallbladder, not the stones. First, the patients will come with the symptoms or the ultrasound report of gallstones. They will consult the surgeon, and the surgeon will examine the patient and also get the patient investigated with ultrasound of abdomen or MRCP and liver function test. After doing that, then he will advise the surgery, because for the gallstones, medical treatment may not work. If at all medical treatment is required, that will be done only for the old patients, bedridden patients who are not eligible for surgery. So the surgery is the ideal and ultimate treatment for gallstones, which is called as a laparoscopic cholecystectomy, where the gallbladder, the total entire gallbladder is removed without any problem to the patient. And this laparoscopy has got advantages like patient will get discharged within 48 hours, maximum 2 days, very less pain, small scars, less antibiotics and painkillers. The patients can go to office by about 2 or 3 days after the discharge. And once the gallbladder is removed, they will never form again. And the patient is going to be followed up after surgery with the main surgeon who has done the laparoscopy. So it is a safe surgery and ideal surgery in this common as this is one of the commonest problem which is faced by the society nowadays. So take care about your food and water. Don't go for the junk foods, go for exercise and take lot of fiber diets, fruits. So prevent gallbladder stones as much as you can. Thank you for watching and hearing my talk. Please like our channel, subscribe, share and give comments and press the bell icon to hear my health talks from St. Theresa Hospital, Sanath Nagar, Hyderabad.